Hi there, it's Dermot again. I'm just going to continue with my series on addiction, and just today I'm just going to look at, I suppose, trauma and the relation to trauma and addiction. Dealing with post-traumatic stress disorder in recovery. So just to introduce this, so what is PTSD? Did trauma cause my addiction? How does trauma affect my recovery? How best to deal with my trauma, and can I remain clean and sober even if I have trauma? And will I be free of my compulsions after I deal with my trauma? So, what is post-traumatic stress disorder? Well, according to Wikipedia, PTSD is a mental disorder that can develop after a person is exposed to a traumatic event, such as either sexual assault, warfare, traffic collision, or any other threat to a person's life. So, it can happen at any time in life, from even pre-birth through infancy, childhood, all depending on what a person has been exposed to. A lot of the trauma stays in as memories, traumatic memories, and has traumatic emotional problems too. So symptoms may include, as I say, disturbing thoughts, feelings, or dreams related to the event, so flashbacks, mental or physical distress to trauma-related cues, attempts to avoid trauma-related cues, alterations to how a person thinks and feels, and an increase in the fight or flight response. So a person would either stand their ground or run away. And that's according to the DSM-5. So these symptoms last for more than a month after the event. They last a lifetime unless they're treated. Young children are less likely to show the distress, but they may express it through, as it says, through play. So they play act the distress. A person with the PTSD is at higher risk for suicide and intentional self-harm, and that's according to Bison J. Cosgrove, S. Lewis, C. Robert, NP, but also at higher risk for being prone to addiction. So did trauma cause my addiction? Well, 80% of people who present for treatment have suffered from some form of trauma in their lifetime. Not saying that trauma has caused the addiction, but alcohol and drugs have helped alleviate the feelings or the sensations of the trauma. The symptoms of PTSD are classified into the following. So avoidance, staying away from people, places, and things that are reminders of the event. So running away in a sense. Re-experiencing, having flashbacks, thoughts, nightmares. It keeps reoccurring and reoccurring and coming back and not really know what reason for. Stuck in a loop. Arousal and reactivity, difficulty sleeping, being very edgy, angry outbursts, reactive, cognitive and mood symptoms, so distorted feelings of guilt, a negative self-image, memory issues, loss of interest in activities previously enjoyed. So very similar to depression, very similar to addiction. So a lot of the symptoms are very, very similar, very, very entwined. So it's hard to kind of decipher what came first, in a sense, the chicken or the egg. So that's why it's important, that we call trauma-informed practice, when a person presents for addiction, that there is a good 80% likelihood that they have been traumatized in life, and that also has to be looked at too. But we'll get there. So chronic stress, as you say, drug use and vulnerability to addiction, substance abuse, addiction, and post-traumatic stress disorder. Again, they have a complex relationship, as it says, as it can complicate treatment if the person is traumatized. The stress from trauma can make it more likely the person will return to their alcohol or drugs as a means of escape. So, initially people used the alcohol and drugs to avoid the emotions or the feelings they were getting from their trauma. So you take away the alcohol and drugs, which were like a form of anesthetic, and you will re-traumatize the person. So it's a very, very slow process and has to be carefully monitored. So drugs can increase, as I say, pleasure, decrease anxiety, and provide a distraction from the difficult emotions. So how does trauma affect my recovery? So co-occurring PTSD and addiction. So alcohol and drugs, as I said before, provide a temporary respite from the emotional part of the PTSD, from the symptoms, and also help the person avoid the pain. And as the drug wears off, as you say, levels of the stress start to rise, PTSD symptoms come back and can even be worsened. So drinking or doing drugs can also interfere with the decision-making abilities and increase risk-taking behavior. So a person who's mood altered will not be thinking rationally and can do things that are a danger to themselves. Accidents, self-harm, suicide, even as it says, crime, violence, etc. Substance abuse may contribute to the onset of PTSD. Thus, PTSD symptoms can induce a person to use drugs and alcohol for self-medication purposes. Okay. So how best to deal with my trauma? Well, behavioral therapies, CBT, can help people learn how to manage stress and deal with potential triggers, as well as enhancing their own self-esteem and self-belief, and help them to modify their negative thoughts and change them into positive thoughts and then thus positive feelings. Exposure therapy is often useful in helping individuals with PTSD. So as teaching people how to face their fears and traumas, at a slow stage by exposing them to the fear, exposing them to the trauma until, they become, I suppose, conditioned, not so much conditioned, but more aware and able to deal with those experiences, that they don't have the urge to run away or leave the scene. So it's a slow process, but if you take person on a step-by-step journey through it, they do become more exposed to the portrayed risk, and they see that that is not as risky as they thought it was in the first place. So medications may also be helpful, but again, used in conjunction with therapy. That's just maybe initially to dispel, as I say, the anxiety, depression. But again, that's only under medical, I suppose, supervision from a doctor or a GP. Don't be taking medication on your own. And then especially group and individual family counseling sessions, education, as well as support groups. And again, ongoing encouragement can minimize a relapse and enhance long-term recovery. So, residential treatment is a very good platform to deal with both trauma and addiction at the same time, because the person is in a safe environment. They can't relapse if the trauma gets too high, and they will have the supports there around them. So can I remain clean and sober even if I have trauma? And again, the symptoms of drug withdrawal kind of make the PTSD symptoms worse, and it makes it more difficult to stop using drugs. Like I said before, once the pain gets too high, people want to numb themselves, anesthetize themselves, so they'll go back to using. So in a similar fashion, they're using drugs, alcohol as a method of coping with PTSD symptoms. It kind of will delay then the treatment progress, because they find it harder to stay off the drink and drugs, because that is like a medication for them. So the best way to deal with your stress or traumatic stress is by being abstinent. Because once you have kind of a stable recovery and you're grounded, the PTSD is more manageable, and better progress will be achieved. So will I be free of my compulsions after I deal with my trauma? And again, as I say, the trauma is a major trigger to relapse, like I've explained already. Once those triggers are identified and worked through, the less the risk of the relapse, so the risk of being re-traumatized in that sense, and once becoming re-traumatized, relapsing back into alcohol and drugs. So the triggers, the re-traumatized triggers are identified, and the person is exposed to them, and they're lessened in intensity, then the less chance a person will react to those triggers and go drinking or drugging. Compulsions to drink and use could return once the symptoms of PTSD reduce, as a person might feel that they are at last cured. So never goes away, it's always there, so you just have to be wary of that. Addiction is also an illness as well as PTSD. You could be cured of your PTSD but still get compulsions to drink or use. In most cases, if the drinking or drugging resumes again, it catapults a person backwards, and they go back to where they left off, and the trauma can be they can be re-traumatized again, because the memories never go away. The intensity of the feeling does lessen, but that can come back again straight away, because people could then relate addiction and drugs to the trauma again, or be traumatized by addiction or drug and alcohol abuse. So just to summarize that, so PTSD is very common with people in addiction, and it is very common, and it's only just starting to look at that now, just the relation to, I suppose, trauma, as I say, trauma-informed practice as well as addiction therapy, and they both have to be tied in, because they coexist, as they say, and more people again would resort to drink and drugs to alleviate the pain that they feel from a previous trauma. And again, as I say, you could be traumatized as a baby in a cot and not have any memory about it, but you're still traumatized, and the feeling is still there at a subconscious level. So it's like peeling an onion. It has to be worked through. It takes time, but you have to give that time as well. So as I say, treat it simultaneously if you can. Stabilizing the recovery first. So that's what we say, the first thing you have to do is stabilize the person, ground the person, give them time in their so-called recovery to stay off the drink and drugs, because, if they're mood altered, they're in no fit state to deal with anything at all. So it's best to deal with the PTSD once you have a stable, about 6 months of recovery. Anytime sooner, the person is still very raw. They could become re-traumatized again and go back and relapse. So it's good to give a person that time just to become used to being in recovery and ground themselves. So then once you do that, you keep working through both. The addiction and trauma will always be there to an extent. They're in your subconscious mind. They don't go away, so you have to kind of work with them both. But one will kind of not counteract, but help the other, because the symptoms are very similar in trauma and addiction. And sometimes a person has been traumatized through addiction. So once you work through one, you are working through them both at the same time. Trauma and addiction go hand in hand, as I've said already. So if a person does relapse, those symptoms of trauma can come back very quickly, and those intense feelings can come back very quickly. Again, remember, the memories don't go away, they're always there. Well, that's the end of this talk, and just thanks for listening, and I'm sure I'll have another one on the way. Okay, well, take care and have a great day. All right, thanks. Bye-bye.